Greetings from the Indian Journal of Anaesthesia. I, Dr. Rohini Dattatri, will present a guest editorial published in the August 2024 issue of the Indian Journal of Anaesthesia. The editorial is titled Airway Triage, Goodbye Difficult Airway. This editorial is by Johannes M. Huitink. The author is an anesthesiologist at Airway Management Academy, Amsterdam, Netherlands. Over the past few years, there has been a shift in the focus from difficult airway prediction to the development of better airway devices and airway guidelines. However, there has been no reduction in the complications. So this editorial aims to update the airway assessment methods and described how implementing a novel airway assessment method and risk stratification tool can lead to a change in the airway management practice worldwide. There has been a constant search for a method to predict difficult airways, as most of the currently available methods are inaccurate. Most of the available airway assessment methods focus on anatomical difficulties. 93% of difficult airways are unanticipated. Only 25% are predicted correctly if the current airway assessment methods are used. Inaccurate assessment can lead to complications, hence the need of the hour is a better airway assessment method. Most prediction models predict difficult laryngoscopy with Macintosh-shaped plate. Individual parameters and tests perform poorly with low sensitivity and specificity. To overcome this, rating systems were developed to differentiate between patients with easy and difficult airways using a cutoff value of the sum of points in a score. Some of the rating systems used include Wilson Risk Sum Score, L-Ganzori Multivariate Risk Index, Arni Risk Index, Simplified Airway Risk Index, Makocha Score, which is Mallampati Class, Apnea, Cervical Spine Limitation, Mouth Opening, Coma, Hypoxemia, Non-Anesthetist Operator. These rating systems do have flaws and do not predict difficult airways accurately. Unanticipated difficult airway can be associated with numerous challenges and serious complications. So, an accurate airway assessment method is needed to reduce complications in unanticipated difficult airway. A novel application-based airway assessment and risk stratification method has been recently described. It is being termed as Airway Triage Application Method. This method utilizes checklists and an algorithm. It also has a mobile application. The checklists help to identify major and minor airway complexity factors. Isolated presence of minor complexity factors may not be associated with adverse events, whereas major complexity factors such as higher BMI, history of radiotherapy to the larynx, higher Mallampati score are associated with serious adverse effects. Based on this knowledge, weight factors were assigned to the complexity factors, and an algorithm was developed. The checklist summarizes the complexity factors, and an ATAM algorithm generates automated risk stratification score. ATAM does not predict difficult airway. Rather, it triages and risk stratifies the access to the upper airway based on the context. There is no universally accepted definition of difficult airway which can predict the airway-related challenges. So the term difficult airway is not used in this novel method as it is confusing, subjective, and misleading. It uses two terminologies. Basic airway, which is an airway that can be managed by appropriately trained healthcare professional without complications with basic airway management equipment and techniques. Airway rescue will be possible. Complications are low. An advanced airway, which is an airway with low or high complexity that can be managed with advanced airway equipment or skills by an experienced team. Airway rescue may be a challenge in this airway. It is associated with higher risk of complications. So, ATAM helps to differentiate between basic airway management and advanced airway management. It also describes other factors which can affect airway management, such as physical location, human factors, context, availability of equipment, and the experience of airway manager. The domains are important. It is evaluated in the context of time pressure and the patient's clinical stability. ATAM uses two checklists, PACE and HELPET checklist. It can triage within 60 to 90 seconds. Every capital letter describes a domain in which complexity factors are evaluated. Higher the total number of complexity, higher the risk of complications. PACE checklist is designed to exclude complexity factors and triage basic from advanced airways actively. HELPET checklist is designed for the active detection of complexity factors. Presence of abnormal findings triggers the algorithm and triage the advanced airway in low or high complexity. It can generate a maximum of 36 complexity factors for one airway assessment. The total number and the combination of complexity factors and the number of domains is important. After identifying complexity factors, mitigating or modifying the risk is possible, which may help to reduce the risk. The advantage of this novel method is it helps to standardize universal airway management, teaching, practice, and research. It has voice-guided airway stop-and-go timeout procedures and cognitive aids. It may reduce the number of unanticipated airway management problems, thereby adverse events. It should be done with the guidance of a prospective clinical study. To conclude, it is time to say goodbye to the phrase difficult airway and the outdated difficult airway prediction models and implement airway triage application as the new universal airway assessment method. Thank you.